want to turn and talk to you about a recent server loss issue that happened back in January. We're told that due to human error within the Office of Administration, several servers saw outages and some were completely lost. Were the Department of Human Services servers impacted in that outage?
Thankfully, they were not, Senator.
Very good. That's good to know. Are your servers controlled by the Office of Administration?
Yeah, so IT policy and cybersecurity procedures, including those that relate to the servers, are enterprise-wide and are under the purview of the Office of Administration.
Very good. Does your department coordinate regularly with our Chief Information Officer?
Very regularly, yes.
Does your IT department within Human Services talk to OA on a routine basis?
Regularly. We have so many large systems within DHS that work across agencies, and so our team is very involved across, frankly, the whole enterprise in this work. And as you may recall, we are slowly but steadily implementing two enterprise-wide systems, one for licensing and one for case management. So we are very actively engaged with both the big IT and all of our agencies.
How much of your budget is allocated for IT?
All right, so our info systems, and just to be clear, do you mean in the current year, or are you asking about 24-25 proposal?
24-25, please.
Next year, I'm going to print this paper a lot bigger. So for 24-25, $116.4 million.
$116.4 million. Very good. Following along that same line, what can you tell us about the recent cyber attack that hit your department, specifically on Change Healthcare?
Well, thankfully, we don't use Change Healthcare.
That actually, am I correct in understanding that DHS still has a contract with Change Healthcare for your Medicaid fee-for-service population?
No, we don't use Change Healthcare. Some of the entities that we make payments to use Change Healthcare. Many of them do.
So do those entities that use Change Healthcare, do you provide them with personal information of Pennsylvanians in order to provide Medicaid fee-for-services?
So the relationship with Change Healthcare is one of claims processing. They're like a clearance for the claims. And so the way that would work is that a hospital or a doctor's office would submit a bill. That bill would have all the necessary information in order to pay the bill and assure that that is an individual who's enrolled in Medicaid. So it's not really us providing
They would have to have some kind of
them.
personal information about Pennsylvanians in order to make a determination on payment.
That's correct.
So they do have Pennsylvanians' information, and that information comes from you to
That
the
information
healthcare?
comes from a patient going to a doctor, saying, here's my card. You know, we all know what it's like to go to the doctor's office, right? Fill out all that paperwork. They write down all your numbers, your social security, and then when the doctor is done, the doctor generates a claim, and that goes to Change Healthcare.
And why does it go to Change Healthcare?
Because that is who that provider has contracted with to process their claims.
And do we have contracts with the providers that contract with Change Healthcare?
So in fee-for-service, not directly. Our managed care organizations would have contracts with providers.
And so are our managed care organizations using Change Healthcare?
Some do and some don't.
Okay, so you do in fact work then with Change Healthcare in those circumstances. So one of the things
I do want to be clear about this point, Senator. I think it's important. They're an intermediary. There's not a direct relationship here. They are literally sending a claim from point A to point B. So
and
we
I understand
indirectly,
that, but
I just
you
want to be
have
clear
the
that we don't have
ability
a
to
direct.
make determinations on which intermediaries
No,
are used.
we do not.
Okay. So I am understanding that because of this outage, there are hospitals reporting that they're unable to file claims, any or most of their claims. So are you working with those hospitals to get them back online as a result of this?
So as I mentioned right before lunch, we just put out some information for our fee-for-service providers on how they can do a workaround to get directly into our Promise system to submit their claims. They can even send us their claims by mail if they want or have them delivered. In terms of the others, it's a complicated situation that will vary from MCO to MCO or commercial health insurance. And again, many of them have turned on parallel relays, backup relays. Some have, some haven't. We are in regular communication with the Hospital Association of Pennsylvania and the Insurance Commissioner. As I mentioned earlier, we are extremely worried about this. I think that this is an evolving problem and we don't know the extent of it yet.
And I appreciate that, and I also am concerned whenever anyone says this is a very complicated issue, because I've often found, working in the space, that's typically what's said when people don't want to explain what's actually happened.
I'd be happy,
my
Senator.
apologies,
I
and
can
if I
hand
could
you
finish,
this.
I really would like to know what data has been impacted, how this is being worked to be resolved, and how we're going to make sure that those people who have been impacted are appropriately notified. So I thank you very much, Madam Secretary. Thank you, Mr. Chairman.